My name is Dr. PJ Madam Rafi. Today we are going to discuss about antipsychotics. So first of all, what are the psychiatric illness we have? We have two types of psychiatric illness, that is psychosis and neurosis. The major difference in between both will be insight. Okay. So what is insight? Insight means awareness about the disease. In psychosis, patient doesn't have insight. Means insight is absent. He doesn't know about his disease. In neurosis, insight is present. Patient knows the reason for his disease. Okay. So in coming to, we'll see in detail in psychosis. What is psychosis? Psychosis will have two types of disorders, that is schizophrenia and mood disorders. Schizophrenia, the main neurotransmitter affected will be here dopaminergic overactivity. That means increasing of dopamine in the limbic system. Okay. So how do we treat? Obviously there will be increasing of dopamine level, right? So we'll use dopamine blockers and dopamine depleters. Okay. So coming to the mood disorders. Mood disorders is also known as affective disorder. Here we'll have three types. Mania means excessive extremes will be there. Followed by depression. Then bipolar. Bipolar means a patient will have two poles. One is maniac phase followed by depression phase. In between you'll have some normal life also. So this is about psychosis. In these diseases, patient doesn't know about his disease. Coming to neurosis, neurosis means where patient knows insight, means he knows the pathology for his disease. Examples like general anxiety disorder. If you see in general anxiety, it is an anxiety. Patient knows about the reason of his anxiety. Like example for any exams, interviews, any performance anxiety. So he knows what is the reason for his anxiety. Okay, that is the main. That is the example for insight. Insight means he knows about his disease. In psychosis, he doesn't know about his disease. Okay. So what are the other examples in neurosis? Anxiety one, first thing. Second is phobia, fearness about whether it may be animals, whether it may be places, heights, anything. Okay. Samely, OCD. OCD is obsessive compulsive disorder, and bulimia, that is eating disorders. Next, followed by post-traumatic stress disorders. These are all conditions where patient knows about his illness. What is the main pathogen causing all this illness? He knows about this disease. Next, what are the drugs we will have? Here we have group of drugs, mainly typical antipsychotics and atypical antipsychotics. In typical antipsychotics, we have phenothiazines, thioxanthines, butorphenones, and atypical antipsychotics. Among these are group of drugs, we mainly use chlorpromazine, then haloperidol, then trifluridol, among in typicals. In atypical we are mostly using, because compared to typical, atypical we have less side effects. Okay, that's why we are mostly using atypical antipsychotic like clozapine, risperidone, olanzapine, ptipine, aripiprazole, zotipine. These are not the drugs we are mostly used. Because of these typical antipsychotics, they will form major side effects. Okay, what are those? We will see in following slides. So what are the therapeutic uses? Therapeutic uses means psychiatric, mainly psychiatric indication. Obviously, that is schizophrenia. Because of overactivity of dopamine, we'll use this one. Next, drug-induced psychosis like LSD, amphetamine. They will induce psychosis like illusion, delusion, hallucinations. So to overcome all those things, we'll use these antipsychotic drugs. Then schizoaffective disorders. In these schizoaffective disorders, patient will have two phases. One is maniac phase followed by depression phase. So based on the phase, we'll use, if he's in depression, antidepressant drugs will use. If he's in mania, we'll use lithium. Samely, Tourette syndrome. Okay, Tourette syndrome is mostly seen in pediatric age group. This is a syndrome where patient will have, he will make noises and sounds. Some new sounds will be formed. Okay. So what is the drug of choice? This one is haloperidol. Next, Huntington disease. Huntington disease mainly due to Huntington gene. Okay. Next, these are the psychiatric indications. In these diseases, we will use antipsychotic. Samely, some non-psychiatric indications also there. What are those? Means we will use as a antiemetic and pre-anesthetic medication and hiccups. Okay. In antiemetics, we will use like chlorperazine, then domperidone, metoclopramide. So that's why if you see any antiacid that will have domperidone, we'll use that because of antiemetic property. Okay, like Pandy, pantoprazole, domperidone, Rantac, domperidone, Sompraz, domperidone. So we will use these drugs as a antiemetic. At the same time, pre-anesthetic medication. Pre-anesthetic medication because of we need to relax the patient. So promethazine we will use as a pre-anesthetic medication. Next, main MCQ they are asking hiccups. What are the drug of choice or hiccups? We'll use chlorpromazine or haloperidol. These are the muscle spasmolytics. Okay. In mainly hiccups, there will be this diaphragm will get spasm. So obviously because of the spasm, we'll get hiccups. So these drugs will use to relieve the spasm. So in this antipsychotics, whether if they are asking question means they were mainly focusing on ADRs. Okay, so you should know all these ADRs. Okay, so mostly antipsychotics, mainly typical antipsychotics, they'll form extrapyramidal symptoms. Okay, so what are those extrapyramidal symptoms? First, acute muscular dystonia means patient will not able to maintain muscle tone. Okay, so mainly this is the earliest. If they are asking what is the earliest also. If they are asking earliest means acute muscular dystonia is the earliest symptoms will happening. So what are those dystonia of torticollis means he is not able to maintain head in one position. It may be some right, left, some position he will not fix to one position. Then locked jaw because of the jaw will get locked. Okay, because of these are muscle dysfunctions. Okay, then oculogyrus crisis, this eye muscles will get spasm, all those things. Then akathisia means irresistible desire to sit in one place. Patient will come into the OP and he will not able to sit in one place. So that is the main side effect. Next, how do you treat this thing is propanol or anticholinergic drugs will use. Then drug induced Parkinsonism. Okay, because Parkinsonism, the neurotransmitter dopamine will get decreased. Because of we are using schizophrenia, anti-dopaminergic and dopamine depleters. Because of overusing of this one, there will be landing of Parkinsonism. Because schizophrenia, dopamine level is increased. In Parkinsonism, dopamine level is decreased. Okay, that is because of you are using overusing of drugs in schizophrenia, patient land up in Parkinsonism. That is a major adverse effect. So how do you treat? Benjexal. Next, tardive dyskinesia. This is also muscle disorder. This is happening in lastly. Okay, they are asking what is the earliest symptom? Acute muscular dystonia. If it is they ask lastly, that is tardive dyskinesia. So how do you treat? Valbenazine. Okay, there is a other side effect will be malignant neuroleptic syndrome. Malignant neuroleptic syndrome will be having hyperthermia condition because of muscle spasm. There will be continuous releasing of calcium will be there, leads to rising of temperature. So how do you treat dantrolenium sodium? Okay, this is a neuromuscular junction inhibitor. Obviously, muscle contraction will get be relief. Okay. So other than extrapyramidal symptoms, there will be some other toxicities will be also be there. What are those? Hyperprolactinemia. Why hyperprolactinemia happens means we are using anti-dopaminergic drugs like, so we are decreasing dopamine. Dopamine is an inhibitor of prolactin. So when you are decreasing dopamine level, obviously it will rising prolactin because dopamine is an inhibitor of prolactin. When you are inhibiting dopamine, the prolactin level will be increased. So what will causes? It will causes hyperprolactinemia, gynecomastia. So how do you treat? By using dopamine analog like bromocriptine. Okay. Next, clozapine induced agranulocytosis. This is the main MCQ. Agranulocytosis will caused by which of the antipsychotic drug? Clozapine. Next, quetiapine induced cataract. Which of the antipsychotic drugs will cause cataract? Quetiapine. Okay. We have to remember these two. These are the recently asking questions. Clozapine induced agranulocytosis. Quetiapine induced cataract. Thank you.